Good afternoon. I'm Dr. DeGeNerative, CEO and founder at Duke Spine Institute. Welcome to our live stream of spine surgery here at Duke Spine Institute. Our patient comes from New York. He's been suffering with back pain for over 2 years. He's had a history of microdiscectomy in the past, and during that procedure up in New York, they took away bone and ligaments from his spine, which in my opinion causes instability and pain later on. So he's here with back pain that he wants to get rid of. He has 2 discs causing the back pain. I would like to confirm that. And he has sacroiliac joint pain in both SI joints. So we're going to fix those today as well. The first stream will be the disc surgery. I'm going to inject some little local injection. Our patient is under propofol sedation, meaning that he is getting IV sedation, but he's sleeping. We want him comfortable sleeping while I place the needle. I'm going to place 1 needle at L5S1. I'm going to place 1 needle at L45. Once I've placed these needles, I'm going to gain access to the disc that is damaged, specifically L5S1 and L45. And then I'm going to repair these 2 discs with the Duke laser disc repair. AP, now why are we treating his discs as the source of his back pain? That's because we confirm the discs are the cause of his back pain through our clinical diagnosis. Perfect. Doesn't get any better than that. He was asking me before surgery, am I going to have trouble getting into L5S1? I said, I don't expect to, because your facet joints are normal size. But you can actually see part of his facet joint is missing. Jordan, show us the facet at L45, the inferior articular process, 4-5. Go up. See that big inferior facet? No. Show the posterior. Yeah. Now look below at the next one down, and you can see it doesn't look the same. It looks cut right to the right of that, Jordan. A little down. There. It looks cut there, doesn't it? It's not fully there. See the shadow of the other side? Yes, that's because you're seeing it lighter because there's only one side that has that facet. The other side was drilled away by his original surgeon that did the microdiscectomy. We don't recommend microdiscectomy because it's a destructive procedure. It's an old procedure, been around a long time. I don't recommend it ever anymore to patients. It's too destructive, and it doesn't fix back pain. The Duke laser disc repair, on the other hand, does fix back pain. All right, we're getting into the L5S1 disc first shot. Let's see what's going on here. We're kind of stuck on something. He's got a pretty collapsed disc, but it is bony here. I've got to figure out why. Why? I think I'm hitting the bottom of L5. Yes, I was. Now I'm heading into the disc. Shot, still very collapsed. But doesn't matter. That is not the cause of his pain. Collapsed discs don't cause back pain. There are millions of people with collapsed discs and no back pain. What causes back pain is inflammation in the small tear in the back of the disc. Okay, so at 5-1, I am shot. I think we're off a little, Jordan, just a little bit on orbit. Let's see if we can improve that. That may be part of the problem. Shot? I mean, on the lateral view, it looks amazing, right? Give me an AP. Do we have num-num? Is this it? I'm going to numb up the skin a little, so we're going to make an incision in just a moment. Once I am done at L5S1, I'm going to move on to 4-5. Yeah. I actually feel like looking at that image, it's possible. Lateral shot. All right. Well, I may have to get in later on when he's more asleep. Shot. But Jordan has gotten the end plates lined up beautifully. I don't really see a good reason why we wouldn't be able to get in right now. But I'm going to go ahead and make my incision, and we're going to get into the L45 disc as well. We have 2 discs to repair today, not just 1. Our incision is 7 millimeters. The surgery is almost bloodless. We have usually on average around one milliliter of blood loss the whole surgery, even when we're doing 2 or more discs. Any questions from our audience?
At this moment, no current questions.
Then go ahead and show the audience how it is that disc injuries cause back pain. I'm Dr. R. DeGeNerative with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4 millimeter incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke-Majan. Thanks for joining us. You guys are both up in the northeast. Welcome back. You can see from the video that there are 30 common causes of chronic back pain, okay? And the most common by far is a disc injury. And Duke Spine Institute was the first to discover this. About 20 years ago, we discovered it. And we have been doing this procedure on the disc, specifically on the tear in the back of the disc now for about 20 years, okay? In 20 years of doing this surgery, we've never had a surgical complication. What is a surgical complication? It's a complication from the surgeon. The surgeon makes a complication. For example, I hit a blood vessel or damage a nerve or have a spinal fluid leak or something like that, or an infection. We've never had a single complication on the surgeon's side, okay? And it's a very safe procedure. That's 2,650 surgeries. About 2/3 of them were in the lower back, and 1/3 of them were in the neck or thoracic spine. Most common is lower back by far. Second most common is cervical spine, herniations, followed by thoracic. All right, this is the L4-5 disc. You can see the herniation. It's blue right there. I've stained it blue with a dye. When I tested this disc just a few minutes ago while you guys were watching our video, we did a discogram called an evocative discogram, and the patient said, "Oh, that's my pain." And what he's referring to is that's his typical pain that he gets every day. It was a 10 out of 10. So he had 10 out of 10 pain from this disc, and that confirms 100% that the disc is the source of his pain, okay? Because it's called concordant pain, meaning it's the pain he gets every day. Let's keep the noises to a minimum. Everything okay over there? Yeah. All right, any questions?
Yes, we have a question coming from Donna on Facebook.
Donna. Yes, Donna.
Asking, can SI joint pain mimic sciatica, or can SI joint issues cause problems to the sciatic?
That's a great question. So the SI joint, sacroiliac joint, for those of you who don't know, is the joint between the tailbone or sacrum where it connects to the iliac bone. The sacroiliac joint has gotten a lot of attention in the last 20 years as a common source of back pain. At Duke Spine Institute, we believe it's the 4th most common cause of back pain, almost tied for the piriformis muscle. So the sacroiliac joint and the piriformis muscle are about tied for 3rd and 4th in terms of the frequency as a cause of back pain. Now, the SI joint has a front part and a back part to the joint. And the front part of the joint is in the pelvis. And the sciatic nerves do run through the pelvis as they head down the leg. So the SI joint can definitely get inflammatory mediators and inflammatory liquid around the nerves that go down your leg, and they can actually cause pain in your groin that radiates from your back to your groin, pain in the back, obviously, around the SI joint or just above the butt crack to the sides. And it can also cause, kind of like inguinal pain in your inguinal area where your hernia would be, an inguinal hernia. So yes, it can go to different areas, and in different patients, it manifests itself differently. This patient right now has sacroiliac joint pain. That's going to be our second procedure on him. We're going to fix his 2 discs that are causing pain, and then we're going to fix the SI joint with our Duke plasma rhizotomy. That will be a second stream. So far, I'm seeing a lot of scar tissue, some calcification, lots and lots of scar tissue, lots of inflammatory tissue right here. A little bit of fat in the epidural space. We're just about done with this disc. I need 3 more minutes on this disc. Very thick scar tissue from the chronic inflammation. So Henry, speaking of disc pain and inflammation,
Yes.
let's show the audience how a disc injury causes so much back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Thank you, Henry. All right, so you can see from the video that the disc injury called an annular tear, which is a tear in the annulus, that allows the nucleus pulposus, which is right next to the tear. And by the way, when you get a traumatic injury to the disc, you not only tear the annulus fibrosus, you make a tear in it that allows the nucleus to come out through the tear. It's called the path of least resistance. That's why it comes out whenever you do any kind of activities that put pressure on the disc, like bending or lifting. So you also fragment the nucleus right next to the tear. So the traumatic injury to the disc is a crushing, shearing injury that overwhelms the capacity of the annular fibers to resist deformation. They end up tearing, and when they tear, it also crushes the nucleus pulposus right next to the tear. What happens then is you end up getting a fragmented nucleus next to the annular tear. Now over time, those pieces of nuclear fragments work their way out of the tear, and they work themselves into the tear itself. So you have a tear that is stuffed now with pieces of nucleus pulposus. And that causes the inflammation that you guys saw on the video. All right, just about done. Grabber. Any other questions? If not, we're going to show you how we fix these disc injuries with our laser procedure at Duke Spine.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. We've just completed the Duke laser disc repair annular debridement at L4-5, and we're going to work on the L5S1 next. Any questions?
Yes, we have a question coming from Donna once more on Facebook asking, is it possible with SI joint pain inflammation to cause the upper butt muscle to spasm?
Is it possible to have upper butt muscle spasms with SI joint? Typically, no, but I'm sure it's possible. But I don't think that's necessarily what's going on. I think you need a real diagnosis. It sounds like you're trying to self-diagnose, which is never good. Let's do a discogram. All right. We don't need evocative.
You just said 10.
Shot. Did he really? You guys see the tear? Shot. Show the tear in the back of the disc there. Yeah. So there's the dye leaking out from the center through the tear. That is where his pain's coming from, folks. We've just debrided the tear above. Show the tear above. You guys see the tear above there? We just cleaned that one out. And that one should be good to go. We're going to fix the bottom one now. Any questions?
At this moment, no current questions.
All right, we've shown the 30 causes of chronic back pain video.
Correct.
We've shown the what causes discogenic back pain.
Correct, and how it is that we cure
how we
it.
fix it.
Correct.
Here at Duke Spine. And what else is there? Anything?
Well, since they're about to, we're going to show the SI joint. Yeah, correct.
Yeah, because he has SI joint pain as well.
Exactly.
That's brilliant, Henry. Thank you.
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Duke plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from the video that when you have an injury to the sacroiliac joint, it can cause very bad joint pain, just like if you had arthritis in your knee or hip, it hurts to move. And for years, we were treating the SI joint pain with shots, but the shots never fix the problem. The pain always comes back. It's just a matter of a few weeks or months. And somebody decided, well, let's do some fusing of the SI joint since it's an arthritic joint. So for years, SI joint fusion became very popular in America and around the world. But we would note that our patients that we fused their SI joints, they never did very well. Like they continued to have SI joint pain. And so it wasn't long before we realized the SI joint fusion just doesn't work. And now there's evidence out of Europe that SI joint fusions don't actually work. And so we don't recommend fusing the SI joint anymore as a treatment for sacroiliac joint pain. Many doctors are still recommending it because, frankly, it's a high-paying procedure. It pays a lot of money to the surgeon. And so because they're making tons of money doing these procedures, they don't want to stop recommending them to patients. They don't want to stop doing them, even though they don't work. Quite often they don't work, and patients are in worse pain afterwards than they are before. So that led us at Duke Spine Institute to find a solution for patients with sacroiliac joint pain. And we knew that there was a procedure called a rhizotomy where doctors could go in and use a radiofrequency probe to burn the pain nerves, there's 5 of them, to the SI joint. The problem is that the RFA doesn't really last. If it works, it doesn't last. And the patients come back because the nerves supposedly regrow, and in reality they don't regrow, they just heal because they never were cut anyway to begin with an RFA. But we took the Duke plasma rhizotomy, which is a patented procedure, and we applied it to the SI joint, and lo and behold, we were able to cure SI joint pain in our patients who had the procedure done. When I say cure, what I mean is get rid of the SI joint pain completely and permanently, so it never comes back. Again, that's with the Duke plasma rhizotomy, which is a patented procedure developed here at Duke Spine Institute by me, the founder. So, Duke plasma rhizotomy, permanent elimination of SI joint pain. It works 95% of the time. There's a few cases where the nerves are buried so deep in the joint they're very hard to get to. We've had to repeat the procedure, but every time we repeat it, it's successful. So I would say the procedure is very, very successful, the Duke plasma rhizotomy, and that's what we're going to do for this young man once we're done fixing his 2 discs. We're just about finished with the second disc, which is the L5S1 disc. Now this is the more collapsed disc, but we don't care if a disc is collapsed. That doesn't cause any symptoms. Collapsing of the disc does not cause symptoms. There are millions of people out there with collapsed discs in their back, zero disc left, and they have no symptoms whatsoever, none. So it turns out that collapsed disc is not the cause of symptoms, but a lot of surgeons will tell patients they need surgery on their spine because their disc is collapsed. And basically they're just unfortunately not telling the truth. Now, they may be saying this because they're confused themselves as surgeons about what's happening, but they may also be saying it because the surgery they're proposing pays them a lot of money to do that surgery from the insurance company. So they're getting compensated quite a bit. Most of you don't know this, but many times spine surgeons are compensated not just by your insurance for doing your surgery, but also by the companies that manufacture medical devices. These companies include companies like Medtronic, DePuy, Johnson & Johnson, Alphatec, Nuvasive, and it used to be companies like Synthes and DePuy, Globus is another one. And they all pay surgeons money, one form or another. Many of the surgeons that are out there that are busy doing lots of surgery, referring a lot of cases to them, they end up compensating these surgeons monetarily, which, you know, it's really a form of kickback, if you ask me, but they disguise it as what is called consulting fees or royalty payments. And what I've seen personally in this industry over the years is the surgeons are being basically compensated, in my opinion, for referring patients to have surgery with the implants from that company. Okay? So the company is getting rich. They're getting $5,000 for, say, a cage that's put into the disc. From the hospital is paying them $5,000 per cage. A lot of patients need 2 or 3 cages, and so that's $15,000 in cages. And then the medical device companies making money on every screw. Some of these screws are sold for $1,000 a screw. Of course, these are just screws that, you know, are made out of metal, titanium metal, which is very common metal, and you could probably get them manufactured for very little money, you know, maybe a few dollars, and of course they're getting $1,000 per screw from the hospital. So the hospitals are obligated to pay for these implants that go into the patients that the surgeons are operating on. And the hospitals never choose the implants. They tell the surgeon which implant they're going to be using. Some surgeons determine which implant companies the hospital will work with. Those are the top surgeons, and they basically tell the hospital what implant company that hospital is going to use. Now the lower surgeons or junior surgeons down the totem pole, those surgeons are sort of stuck using the implants from that device company because there was sort of a deal negotiated by the more powerful surgeons in the group. And of course the more powerful surgeons in the group, the ones that have influence over which implant companies, device companies are going to be able to sell their devices in that hospital, those guys and gals are the ones that are getting, in my opinion, the biggest kickbacks in many circumstances from the implant companies. Okay? So in the end, if you step back and look at it, the situation arises and has arisen in the past where spine surgeons are getting kickbacks in one form or another, either financially or in some other type of kickback, for recommending patients have specific screws, rods, and cages put into their spines. Okay? In my opinion, it's incredibly unethical behavior, but it's rampant. It happens in a lot of places. I'm not going to tell you specifics like where it happens in particular, but it does. Look at that there. That's the inflammatory tissue in the back of the disc.
At this moment, no current questions. So in the meantime, why don't we show the audience as well the how it is that we cure piriformis muscle pain?
Well, I'll tell you what, let's do this. Yeah, I think that's a good idea. Let's do the piriformis video, and then let's go ahead and end the stream and get ready for the SI joint, because I'm about 2 minutes away from being done with this painful disc at L5S1.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. Take a look. We're done here. This is 5-1. There is scar tissue. I cleaned it up. There's some bone spur right there. But overall, his disc looked pretty damn good. He was concerned there would be a lot of scar tissue, but there's not. But I did get rid of the herniation with the laser and the grabber, and this thing should heal up beautifully without pain. I would expect 95% of his pain to be gone. permanently from his lower back after today. Now, we do have some people who develop additional sources of back pain. For example, we're treating the discs and the SI joint, but they may come back with piriformis, like you guys just saw. And if they come back with piriformis, obviously that's not something they had today or yesterday, but they developed it. So is it possible for patients to come here, have things fixed, and then develop additional sources of pain? Yes. We have no interest in not diagnosing your pain sources. So if you come here and you have disc pain plus SI pain, but you don't have piriformis pain, we're not going to diagnose you with piriformis pain if you don't have it. But the point is, at some point you may get it if you're not using your body properly or if you already had a torn piriformis muscle. And so what happens is people do leave, they come back with a different kind of pain. That's about 25% of our patients. Shot? All right, end the stream, come back.